So I'm the director for a student program at Northwestern called the Education Centered Medical Home, or ECMH for short. It's a program we started about 4.5 years ago as a way to get more students involved in primary care early on in their training. The idea being they start working in a clinic as a first-year medical student and they stay there for all 4 years. We've been thrilled to get this grant as a way to build up the program and study it more academically and find out more ways where we can make it better and potentially expand it. I think our program is exciting and essential because about 4 years ago when we set out, we realized that one of the most important things we needed to change about our medical student curriculum is the fact that they never saw the same patient back for a follow-up visit. As a primary care doctor, I feel it's critical if you're going to improve health outcomes, if you're going to improve healthcare disparities, if you're going to improve social determinants of health, there's no way to really understand those things without continuity. And we think that our program is exciting. We're trying to build a sustainable model where students can experience continuity of care and really understand the deep dive impacts of social determinants in health on their patients over time. Social determinants of health are so important and they're so ubiquitous in healthcare, but without experiencing it and seeing it in real life, how unique patients are affected by economics, by transportation issues, insurance issues, barriers on the phone, barriers in communication. When you have your own patient and you see how they struggle and you coach them and you see them continue to struggle, it really does reinforce that this is challenging and that we need to address multiple things. It's not as easy as just telling the patient what to do. I think we've created an environment where students, they get this, they all graduate the program having seen several patients back long enough to see how difficult it is. And I think we're creating opportunities where they really take ownership and they feel proud of themselves. They're part of the healthcare team. And I think if they graduate, at least having had one patient, they can remember that they got better, that they coached and kind of addressed some of these barriers to care. I think it's going to change the way they train as a resident. I think it's going to change potentially career paths they choose. I think it'll be very impactful.